Good evening, Iligan. Good evening, world. We are having this event in commemoration of the International AIDS Candlelight Memorial 2021. I am Dr. Mary Jane Concepcion, the HIV Core Team Chairman, Physician of the Adventist Medical Center Iligan, Haven. I am tasked to talk about the overview of HIV infection to increase the awareness of the disease. As for the global HIV status, there were 75.7 million infected with HIV since the start of the epidemic, and 32.7 million died from AIDS-related illnesses since the start of the epidemic. And there were approximately 38 million people across the globe currently with HIV and AIDS in 2019. Of these, 36.2 million were adults and 1.8 million were children less than 15 years old. The reported HIV cases in the Philippines was 81,169 from January 1984 to October 2020. It was around 45,023 from January 1984 to June 2017. The HIV infection rate in the Asia-Pacific region has shown that Philippines, Pakistan, Bangladesh, Afghanistan, and Papua New Guinea are facing a rapidly expanding HIV epidemic. The Philippines is experiencing the steepest rise with new infection up by 200% between 2010 and 2018. So, what is HIV? HIV stands for Human Immunodeficiency Virus. It infects only human beings. It decreases or weakens the body's ability to fight off infection and illnesses. And the virus has the ability to replicate only inside a living cell. There are two types of HIV virus, HIV-1, which is most common in sub-Saharan Africa and throughout the world, and HIV-2, most often found in West Central Africa, parts of Europe, and India. Both produce the same pattern of illness, and the HIV-2 causes a more slow progress of disease than those with HIV-1. This is the structure of the HIV virus. It looks like a spherical particle of 80 to 100 millimeters in diameter. Like all viruses, it is made up of two main elements, the external envelope and the internal core. Viruses in general are made up of a core with RNA or DNA and sometimes an external envelope. And HIV is a retrovirus. Our body is protected by the immune system made up of white blood cells. And how does HIV affect the immune system? The CD4 cells are a type of white blood cell that play a major role in protecting the body from infection. The HIV attacks and destroys the CD4 cells of the immune system. The HIV uses the machinery of the CD4 cells to multiply and spread throughout the body. This process is carried out in several or 7 steps or stages. There are 6 points in the chain of HIV transmission. And HIV is the infectious agent, and the reservoir are the humans. And HIV is spread only in certain body fluids, blood, pre-seminal fluid, semen, vaginal, cervical, or rectal fluid, and the breast milk. And the mode of transmission is through sex, injection drug use, mother to child, and other transfer of body fluids. And the portal of entry are the lining of the vagina, rectum, and opening of the urethra in males, wounds or break in the skin, and there must be a susceptible host, which is the humans. So again, there are 4 body fluids known to transmit the HIV, which I have mentioned before. In the Philippines, we follow the World Health Organization classification system in the disease progression of this disease. Within 2 to 4 weeks after HIV infection, some people may have flu-like symptoms such as fever, chills, and skin rashes, and this may last for a few days to several weeks. The window period from 2 weeks to 3 months is the time from initial infection with HIV until the antibodies are detected by a single test. Some may have a false negative result, and testing should be repeated after 3 months because it takes about 3 to 8 weeks before antibodies are detected. HIV infection has various stages from primary infection or acute phase to asymptomatic phase or chronic phase because more severe symptoms do not appear for many years, and without treatment with antiretroviral therapy, HIV infection advances to late stage of this disease or AIDS in 10 years or longer, and it may advance faster in some people. In this stage, opportunistic infection comes in, and the severity of the illness is determined by the amount of virus in the body, as determined by the increasing viral load, and the degree of immune suppression as determined by the decreasing CD4 count plus the AIDS-defining symptoms. So HIV transmission is possible at any stage of HIV infection. So, what is AIDS? AIDS stands for Acquired Immune Deficiency Syndrome. AIDS results when HIV infection progresses to an advanced stage, damaging the immune system to a point at which the body can no longer fight illness. This makes a person with HIV vulnerable to a group of illness, example of which opportunistic infection, which does not affect easily healthy persons. AIDS is a syndrome because it is characterized by a group of illnesses. And AIDS is the final stage of the disease caused by infection with a type of virus called HIV. So HIV is the virus that causes AIDS. Not everyone who is infected with HIV has AIDS. Everyone with AIDS is infected with HIV. AIDS is a result of the progression of HIV infection. Anyone infected with HIV, although healthy, can still transmit the virus to another person. So what is an opportunistic infection? Opportunistic infection refers to illnesses caused by various organisms which do not cause diseases in persons with healthy immune system. So examples of opportunistic infection: TB, fungal infections, Kaposi's sarcoma, shingles, cervical lymphadenopathitis, and There are several risk factors for HIV transmission through sexual contact between male to female or in men having sex with men. The risk of transmission is 10 times higher in anal sex than vaginal sex, especially receptive anal sex, which is the riskiest type of sex for HIV transmission because the lining of the rectum is thin and may allow HIV to enter the body during anal sex. Vaginal sex also carries a risk for getting HIV, but less risky than receptive anal sex. Oral sex is regarded as a low-risk sexual activity and possible if an HIV-positive man ejaculate in his partner's mouth during oral sex, especially those with oral ulcers, bleeding gums, genital sores, and other sexually transmitted infections. Majority of infections in the Philippines through sexual transmission is increasingly from male to another male. There is a 90% of risk of acquiring HIV through transfusion of infected blood and blood products. Reusing or sharing needles or syringes in healthcare settings and through illegal drug injection is a highly efficient way of transmitting HIV. Another risk is mother-to-child transmission during pregnancy, child delivery, or breastfeeding. If no intervention, there is a 15 to 30% risk of transmission from mother to child before and during delivery. And breastfeeding increases the risk of transmission by 5 to 15%. We cannot get HIV through casual contact like sharing food and utensils, shaking hands, hugging or kissing, coughing, sneezing, using public phone, and visiting a hospital. Sometimes we can receive text messages telling us to avoid a certain canned goods because it has HIV infected blood. So sometimes we can receive that HIV infected blood products are thrown in the sea. So we should not eat the fish caught in that area. So that is not true because HIV cannot be transmitted to food, through food. Neither feces, urine, saliva, sweat, or tears can transmit HIV. By donating blood, when you are donating, you cannot get an HIV transfusion. You cannot get HIV. Sharing toilets, insect bites, and swimming in the swimming pool in the presence of a person with HIV. So how can you protect yourself from HIV? The ways of preventing HIV transmission is rooted in the concept of preventing the HIV-containing body fluids from reaching the portals of entry. So you have to break the chain to prevent infection. And there are ABCDE of prevention. Abstinence is the letter A of the prevention alphabet. So do not have sex. In the case of adolescents, delay the sexual debut. Be monogamous, have one sexual partner, and be mutually faithful with your partner. Correct and consistent use of condom for letter C. Do not inject drugs. Education and early detection. Safe sex practices refer to choices made and behaviors adopted by a person to reduce or minimize the risk of HIV transmission. And this may include non-penetrative sex, correct use of male or female condoms, and reducing the number of sexual partners. So every blood donated at the Red Cross or blood banks have a mandatory testing for HIV to ensure that blood being transfused are safe. For the healthcare workers, they should consider always that every patient is potentially infectious. Hence, they should always practice universal precaution and avoid sharing of needles or syringes for IV drug users. A pregnant woman who is HIV positive can give birth to an HIV negative baby, and if they follow certain precautions. So the mother should take antiretroviral drugs during pregnancy, deliver the baby through cesarean operation, use infant formula instead of breast milk. And prophylactic antiretroviral drug is also given to the baby at birth. Remember, do not use drugs or alcohol, and education make up the letters D and E of the prevention alphabet. You can do a personal risk assessment by asking yourself these questions. Did you or your partners contract sexually transmitted infections in the last 5 years? Did you or any of your partners undergo any blood transfusion or organ transplant from unreliable source? Have you or any partners engaged in unprotected sex, any form of sex, which includes oral, vaginal, or anal, with a person with multiple sex partners? Have you or any of your partners injected drugs with shared needles and or syringes? It is the event that lays the person open to or puts him in real danger of acquiring HIV. So how will you know if you are HIV positive? So HIV infection can only be known by blood testing. It cannot be known or diagnosed based by appearance or symptoms alone. Access to HIV screening can be through voluntary counseling or testing, in which an individual is willing to undergo testing of their own free will. And the provider-initiated counseling and testing is a situation wherein the doctor or healthcare worker encourage patients to undergo testing. Because of co-infection of TB and HIV, the doctor will recommend HIV testing, especially if he or she can assess that the patient has a risky behavior. But before HIV screening or testing, it is a must that HIV counseling should be done. And this refers to the interpersonal and dynamic communication between the client and the trained counselor, who is bound by code of ethics and practices to resolve the personal, social, and psychological problems and difficulties that the client is undergoing in the context of positive HIV test. And for negative HIV test, the counselor encourages the client to explore motivations, options, and skills to stay HIV negative. Mandatory or compulsory testing is prohibited as a general rule, except in 3 instances. 1, when it is necessary to test a person who is charged with offenses punishable under the revised penal code, such as serious, slight, or less serious physical injuries, simple seduction, or rape. Number 2, to resolve issues under the family code as a ground for annulment or determining a circumstance constituting fraud. And number 3, as a prerequisite in the donation of blood in compliance with Organ Donation Act of 1991 and the National Blood Services Act of 1994. So HIV testing is strictly voluntary, confidential, and must be accompanied by pre- and post-test counseling. So the pre-test counseling is the process of providing an individual with information on the biomedical aspects of HIV and AIDS, and emotional support to any psychological implications of undergoing HIV testing and the test result itself before the individual is subjected to the test. And the post-test counseling refers to the process of providing risk reduction and emotional support to a person who has submitted to HIV testing at the time the result is released. So for the screening test, the result given can be either reactive or non-reactive. If it is reactive, it will be sent to SACL for confirmatory or to Northern Mindanao Medical Center for rapid HIV diagnostic algorithm. So what if you test positive? So HIV test screening is just like a pregnancy test. You will be referred to the designated DOH treatment hub for link to care or medical treatment and adopt a healthy lifestyle and positive living to delay the progression of the disease. Baseline laboratory exams are requested, and that includes CD4 count. The CD4 count test is used to check the health of the immune system in people infected with HIV. Viral load is the test to assess the progression of HIV antibody or the amount of HIV circulating in the bloodstream. Viral load assess also how the body and the virus respond to HIV therapy. And HIV treatment includes the use of combination of antiretroviral therapy and medications to prevent and treat the many opportunistic infections. The antiretroviral drugs is for lifetime treatment. And prophylaxis for pre-exposure prophylaxis and post-exposure prophylaxis are also available for free in the DOH designated treatment hubs. The HIV and AIDS law does not expressly say that PhilHealth membership is required to access HIV treatment. But the law does say, however, that PLHIV must be enrolled in a program established by the DOH for people living with HIV. Under our system of health, PhilHealth membership is the primary means of financing health services under the Universal Health Care Law. Thus, membership in PhilHealth should not be seen as a barrier for accessing HIV treatment. People on antiretroviral therapy take a combination of HIV medicines, called an HIV treatment regimen every day to prevent HIV from multiplying and reduces the amount of HIV in the body, called the viral load. The main goal of antiretroviral therapy is to reduce a person's viral load to an undetectable level. And the pre-exposure prophylaxis is given to HIV-negative people to reduce the risk of HIV. Healthcare workers who had an accidental exposure to potentially infectious blood or body fluids should be evaluated for possible post-exposure prophylaxis. These are the second-line ARV. So until a cure is found, the only effective prevention is not to allow the virus to enter the body. Remember these numbers, 1, 2, 3, 4, 4, 5. We have one life only. Number 2, either you have it or you don't have it. Number 3, there are 3 modes of transmission, as I have mentioned before. And there are 4 body fluids that can transmit HIV. And there are 4 requisites for HIV infection. It must exceed, it must have a sufficient amount, it must survive in a new environment, and it must enter the body of the susceptible host. There are 5 means of HIV prevention, ABCDE, which was mentioned before. And the things to remember are: AIDS is incurable and fatal, HIV infection is lifelong, a person with HIV is infectious for life, anyone can get HIV, you cannot tell who is infected, and HIV is preventable. Your health is your best asset, protect it. It is not your occupation, it is your behavior that makes you high risk, such as protected anal sex between males, unprotected sex with sex workers, unprotected sex with multiple sex partners, injecting with used needles. If you think you have the risk, then have yourself tested for HIV. Now na. So where to go if you want yourself to be tested? These are the places that you will go in order to have an HIV screening. Love yourself, be responsible. And thank you for your kind attention. I am Dr. Mary Jane Concepcion from AMCI Haven, and I would like to invite my fellow Iliganon on May 29, 2021, 7 p.m. for the premiere of the first ever Freedom Digital Concert with Marian Osabel, together with the League of Iligan Cities, Beauty Kings and Queens. And this event is for the commemoration of the International AIDS Candlelight Memorial 2021. Maayong gabi, Iligan.